Hi guys, welcome to LDFS. I'm Dr. Lakshmy. Today we'll be discussing about how we can implement the monetary value which we have calculated in our clinic to our benefit. Now, if you have missed the earlier video, please go through that so that you'll understand this video better, because in our earlier video we have explained about how what is a monetary value of your time and how we can calculate it. In today's video we will be discussing about how we can implement it so that we can reach our goal or target. Kindly like, share and subscribe us, and please share it with your friends so that they can also benefit from our videos. Thank you so much in advance. So let's understand now how can we implement the monetary value which we have calculated in our clinic. In our earlier video we have calculated that we want to earn around 2000 rupees per hour so that we can reach a target of 4 lakh per month. Okay, now I know it may not be easy, but we have to work towards that goal. Okay, now imagine a root canal patient walks into your clinic. Okay, you charge around 4000 rupees. Now you divide the root canal treatment into 3 equal parts. You give 3 appointments of each 1 hour each. For access opening 1 hour, for BMP 1 hour, for RC filling 1 hour. So that means you have spent 3 hours of your time doing a root canal, which ideally should have fetched you 6000 rupees according to your calculation. But right now you are getting only 4000 rupees because you may not be able to increase the price right now, whatever XYZ reasons. So that means now what we have to do is we have to prioritize our time. We have to set the clinic up in such a way that everybody knows that my 1 hour should fetch me to get to 2000, or else it should be divided among the other associates. So what we can do is we'll concentrate only on the BMP. That 1 hour we'll be focusing on, and rest everything, the access opening and the root canal filling will be done by the associate dentist. So that whenever I am there in the clinic, that 1 hour will be dedicated to earn the 2000 rupees, which is my target. Okay, now also what you can do is sometimes if you're the treatment is taking a longer time because of maybe the reasons like x-ray, you have a normal developer kind of x-ray, so that takes a little longer time. You take the film, somebody develops it, and then you see it. Sometimes it is right, sometimes you may have to repeat the x-ray, so time goes into that, right? So what you can do is, definitely there's a cost to it. If you are going ahead with the RVG etc., you have to spend some amount. But why is that important? Because that will help you reduce your treatment time. That will help you reduce that 10 minutes or 15 minutes of wastage of developing and taking an x-ray again etc. So that means the RVG is a very good investment right now. In my scenario, maybe good investment, so that my treatment timing will not go more than 1 hour, because I want to earn 2000 per hour. Now when we value our time, our clinic and everybody, our staff will value our time. They'll understand that okay, ma'am or sir will come only for these 5 hours, and these 5 hours they should have back-to-back patients, and every appointment should be, the important treatment parts will be done by the doctor. Like that you can do. If it is something else, maybe crown cutting or something, they'll do the basics and keep everything ready so that you can devote that 1 hour, and then that may fetch you not 2000 but 5000. It can happen. So the cost may be here and there. Maybe you will get sometimes 2000, sometimes 500, sometimes 4000, but eventually you will reach that stage where you can and you will be able to charge 2000. So always upskill yourself, and also see where is the wastage happening. If you are doing 1 hour of work, can you reduce it? Can you reduce it into half an hour? Can you reduce that work of 1.5 or 2 hours into 1 hour? How can you do that? Where is the wastage happening? Is the assistant taking a longer time to have the instruments ready? Is there x-ray unit you're not good? Is the chair giving you a problem? Is compressor giving you a problem? Is the aerator giving you a problem? Whatever it is. So you need to understand that okay, these are the things which are losing my time, which are actually not helping me learn, helping me earn that much which I want to earn in my life, which is not helping me to reach my target. So that ways you will start thinking, you will start analyzing, you will start understanding that okay, my value is important, my time is important. If I am going to the clinic for 5 hours, that means that I should have 5 patients at least, and every patient should fetch me around 2000 rupees. So that is the target which I want to reach. And once you know it and it's clear in our head, that means it will be later on understood by the staff, by patients, everybody. So now this is the way how we can implement of the monetary value which we have in our mind. Okay, I hope this was useful for you, and I hope you reach your goal as soon as possible. So keep upskilling yourself, keep learning, keep implementing new things, and find out your monetary value so that you can implement it and you can earn and reach your goal faster. Thank you so much, guys, and comment below and let us know how did you like this video, and is there any other topic do you want us to cover in our future videos. Thank you. Bye.